Hello, everybody. Welcome. We're going to just take a minute and make sure everybody can join. Welcome, everybody. We're excited to have you here. We're just going to let everybody get online and then we'll go ahead and get started. All right. Well, thank you everybody for joining our webinar today. It's called Advancing Dementia Risk Reduction and Early Detection. We're really excited to have you here. My name is Eva Jackson, and I am an Associate Director with the Healthy Brain Initiative at the Alzheimer's Association. Our work generally focuses on supporting public health departments, and this work on our curriculums does support public health departments, but it's also designed for students, professors, other educators, community leaders. So excited to have such a wide variety of folks in the audience today and learning about these resources and how they can support your work. Before we get started, we are going to talk about brain health today. So if you'd like to drop something in the chat about what you do for your brain health, we'd love to hear from you, see what things you're already doing to engage your brain health. So go ahead and put that in the chat if there's something you'd like to share that you are doing to support your brain health. All right. And as we are looking at today's agenda, I do want to touch on a couple of housekeeping items. So first, we are recording today's webinar, and that is so that it is available to anyone who wasn't able to join us today. It will also go on our website so you can watch it or share it at another time, and we will be sending it out in a follow-up email as well. So it will be recorded and you can watch it again later. If you are interested in using closed captioning, you can enable that on the toolbar on the bottom of your screen. And then we do have a Q&A box. And so if you have questions that come up during the webinar today, please do go ahead and put those in the Q&A box so that our team or our presenters can go ahead and answer them. If we have time at the end, we will be able to do some Q&A, but I encourage you to put those questions in the Q&A box as they come up. I'd like to also acknowledge that this project is funded by the Healthy Brain Initiative Cooperative Agreement with CDC. And so today on our webinar, we are going to spend some time. I'm going to talk about the Healthy Brain Initiative and the work that we do a little bit, as well as about the public health curriculum, the journey it's been on. And then I'm going to turn it over to three wonderful presenters that we have here today, Shelby Roberts, Alexandra Nordyke, and Dr. Matthew Lee. And then I will do a demo of the curriculum so you can get a feel for kind of what it looks and feels like and how to access and use it. And then, like I said, if we have time at the end, we will be able to do a little bit of Q&A. So just a bit of background on the Healthy Brain Initiative, or the HBI as we call it. We are a part of the public health team at the Alzheimer's Association, and we are working to support infrastructure for brain health and dementia for everybody, as we believe that everyone deserves a life with the healthiest brain possible. And so we do that by partnering with public health departments, with tribally led health programs, urban Indian organizations, and also working with students and faculty members. And so really trying to support public health across the span from the current and future public health professionals and whatever facets they may be working on to address dementia and support caregivers in their community. So a little bit about the journey that we've been on with our public health curriculum. It is about a 10-year-old journey, which is kind of crazy to think about. But in 2015, this project started. It was developed as a set of slides that could be used by faculty members who were teaching courses in their classes about public health, about dementia. And so it was just a slide deck they could use to integrate into their work. By 2020, the learning processes and systems had changed and evolved, and there was increased demand from public health professionals, as well as some of those online learning systems of wanting to be able to access these resources. And so the curriculum was updated a bit and a video component was added, which was a YouTube recording of the slides being presented. So people could watch the YouTube video if they wanted to, or use that in their classroom. By 2023, we decided to go ahead and add some new topic areas to the curriculum, as well as change that learning format once again. And so what we did was we built it in an online interactive self-paced module format. So learners can log in and focus on one topic and be able to complete a whole module in that topic. And they'll be reading information and doing activities, really trying to make it interactive to, again, match the online learning environment. And so the first module that we launched in this interactive format was Health Equity and Dementia, using a public health lens to advance health equity in Alzheimer's and other dementia. So again, looking at that intersection of health equity, public health, and dementia, and what public health professionals can be doing in that space. We then partnered with the Bold Public Health Center of Excellence on Dementia Caregiving to do a module on public health and dementia caregiving. And so that was also released in that interactive format in 2023. And then in 2024, we took the original content talking about public health and dementia and updated it into this online interactive format. And so this is kind of the 101, what is public health's role in the dementia space, and what are some examples of what that work can look like? So if you haven't taken part one, I really recommend you do so. It's really an excellent foundation for all of the other modules. So then this year we are launching 3 new modules. We launched part 2, Implementing Public Health Strategies for Dementia, which is really how to use the HBI state and local roadmap, which I'll talk about a bit more, but that's a guidebook for public health action. So it's really building off of that foundational work of public health and dementia, but how you can use that guidebook to really implement that work in your community. And so excited, as of today, we have public health and dementia risk reduction live online. So that's our brand new module. And then coming very soon, we will also have public health and early detection of dementia. And we will talk a lot more about those later today. But those 2 modules will really round out the suite of modules that we offer as we look at what public health can do across the life course in risk reduction, brain health, early detection, and caregiving. So as I mentioned, we do a lot of work with our HBI roadmap, which is a public health strategy, and this is a guidebook. It's backed by leading subject matter experts. It draws on recent evidence-based research, and it's really committed to supporting public health action across the life course. So I mention this because if you are a bold-funded state or a bold-funded community, this is the guidebook that is guiding that work being done in the community. And I mention that because in that guidebook, again, if you're doing bold funded work, one of the main focuses of the roadmap is on building a diverse and skilled workforce, really looking at the outcome of increasing the knowledge and skills of the current public health professional, current and future workforce. And one of the actions that is recommended there, that W2 that you see, is about training the workforce. And so we have developed this curriculum set as a free, ready-to-go resource for anybody that's trying to do W2 as a part of their bold work. So if you're working with coalitions, community members, students, faculty, universities, whoever you're working with, this is, again, just a tool that is ready to go for you to use to implement this W2 action. You'll also notice on here the 2 icons. There's an icon of people and an icon of a cedar tree there. And I include that because in addition to the state and local roadmap, we also have a roadmap for American Indian and Alaska Native peoples. And that was developed to work in conversation, that these 2 documents would work together so that if a tribe was interested in doing work around dementia, they could partner with their BOLD program, or if a BOLD program was interested in working with tribes, they could have documents that were adapted to their communities and their organizations, but that would work in conversation with one another. So that cedar tree icon comes from the roadmap for American Indian, Alaska Native peoples. The roadmap of the 4 people there, that comes from our state and local roadmap. All right, so with that kind of crash course in Healthy Brain Initiative and curriculum, I am going to turn it over to Shelby Roberts, and I'll let her introduce herself and talk with us about public health and dementia risk reduction. Shelby, it's all you.
Eva. Hi, everyone. It's great to be with you today. My name is Shelby Roberts. I am the Senior Director of Public Health at the Alzheimer's Association and lead our Public Health Center of Excellence on Dementia Risk Reduction that I'm going to talk to you about today. So if we go to the next slide, before I dive into the Risk Reduction Center of Excellence, I want to give even more of a little bit of background on the BOLD Act itself. So in 2018, Congress passed the Building Our Largest Dementia, or BOLD, Infrastructure for Alzheimer's Act to expand public health efforts to address cognitive health and Alzheimer's disease. And in doing that, this gave directed CDC to build a robust public health infrastructure. The BOLD Act was then unanimously reauthorized in 2024. And we have been working as a collaborative to implement the BOLD Act with CDC since the BOLD Act was passed. So after the BOLD Act was passed in 2018, as CDC was working to build that infrastructure, part of what they did was establish these 3 centers of excellence. So the centers of excellence that you see here on the screen, dementia risk reduction, early detection, and dementia caregiving, all began in 2020, and we are all turning 5 years old next week. So it's very, very exciting. But we've spent the last 5 years building many resources, talking with so many of you, and really working to assist you as you improve brain health in your communities. And something I am excited about is this partnership that we have had with the Healthy Brain Initiative to bring some of the knowledge sharing and resource sharing of the Center of Excellence into this easy to use learning management system format. So on the next slide, you'll see a little bit more about what each of us do. So the 3 centers align very closely with the 3 levels of public health prevention: risk reduction, early detection, and safety, quality of care, and caregiving. And so each of us focus on that specific area, working with health departments and tribal health organizations across the country to do some of the actions in the roadmap that Eva talked about earlier. And for all of us, the 3 centers work very closely together, along with the Healthy Brain Initiative partners and the BOLD Program Awards, and all towards this larger goal of improving population health around dementia. So we go to the next slide. This is the exciting part of why we're here with the webinar today. So as Eva mentioned, in 2023, the Caregiving Center of Excellence was one of the first new modules that we released. And Dr. Gogler and the Caregiving Center have been using this module. I hope many of you have already taken it. Dr. Gogler even worked to develop a summer course at the School of Public Health in Minnesota around this curriculum. So it's been great to really see it in action. And now we have the full suite of these 3 modules, as Eva mentioned, coming very soon this fall. So you can go through each of them and understand more about the information that the Centers of Excellence have and the resources that we have to offer. Because as I mentioned, we are all turning 5, and we've been working really hard for those 5 years with you all and have made many resources and toolkits as a result of those projects that we've done together. And what I like about these curriculum modules is that it both gives you a crash course in the topic, but also gives you a crash course in all of the possibilities of public health action and resources. So it's a wonderful resource and a great place to start. So with that background, I'll talk a little bit more now about the Center of Excellence on Risk Reduction specifically. So this is the center at the Alzheimer's Association. And as I mentioned before, it is part of the BOLD Act and was established as part of the CDC's effort to increase the public health infrastructure around Alzheimer's disease. So what do we do? So that's the next slide here are the 3 main things that we do and how we like to describe our center. So we review the scientific evidence around the modifiable risk factors for dementia. We translate that evidence into public health action, and we assist public health agencies to put it into practice. And what does that mean? So I'll show in a minute what the review of the scientific evidence has meant for us, and that's a lot of the content that you'll get in the curriculum module. Translating the evidence into public health action, these are many of the products that we've made. So we have lots of videos, infographics, fact sheets, and toolkits on our website that are meant to help you take in this information, but then see how to use it to improve brain health in your community. And then lastly, assisting public health agencies to put this into practice. Part of our mission of all of our centers of excellence is to be here to be a resource for you. So we'll be sharing all of our contact information, and you can always reach out with any questions. We often come speak to different coalitions or groups. We've been invited to, give a guest lecture and a course before. And then we've also been conducting both online and in-person trainings across the country over the last 5 years. So the next slide shows who we are. I hope those of you who have gotten to know the Risk Reduction Center team have had a chance to meet Mikkel Lewis and Kat Colcom, but they lead many of the projects that I'm going to talk about today and Mikkel especially helped make this curriculum module with Eva. So Mikkel and Kat, in addition to many of our partners that I'll mention later, are what make the Center of Excellence the excellent resource that it is. So now we'll dive into a little bit of the modifiable risk factors, and I don't have time today to give the full presentation on the modifiable risk factors, but I also didn't want to spoil all of the great things that you're going to learn as you take the curriculum and the risk reduction curriculum, because you'll go into a ton of detail on this. But there's a couple things I wanted you to take away from this very busy slide. One, there are a lot of modifiable risk factors for both cognitive decline and dementia. And at the Risk Reduction Center of Excellence, we look at many of them. What you see here on the screen are the ones that we keep a very close eye on the evidence around. When the center first began in 2020, we did a deep dive with our partners at Wake Forest University Medical Center. And where we landed is what you see on the screen in terms of modifiable risk factors that had a strong impact on cognitive decline or a strong impact on dementia. And then you'll also see others that had a moderate impact or a lower or unclear impact. And this is based on a rigorous review of multiple journal articles. So we're not changing these opinions as one article is published or another is published. This is based on the body of evidence of all of these items. So the ones that you see on the left had the strongest evidence associated with them. And this is what the Alzheimer's Association has used to develop the 10 healthy habits for your brain. So I'm sure we'll be putting that link into the chat and we'll share it with you afterwards. But this is a great resource that is meant to be public facing as a way to share with the general public about things people can do to improve their brain health. So when we go to the next slide, that chart, while informative, is clearly not all of the information that you are looking for whenever you're wanting to share why something is a risk factor for dementia. So when I mentioned earlier that we review the scientific evidence and translate it into a useful product, one of the most useful things that comes out of the center are these science summaries. So that scientific evidence synthesis that I just described, we have this available to you on our website, which is alz.org/risk reduction. You can go here and download the science summaries that are mentioned on the slide before. So they align with the 10 healthy habits and more of those risk factors that were on the chart. And each summary includes a background and evidence section, as well as a section on the implications for public health and a section on the role of the social determinants of health as it relates to that specific risk factor. So we've taken this approach as a way that we hope is really helpful to you as public health professionals when you're either writing grants or working to justify different projects and programs in your community, that you have a quick way to access this information. We just went through and updated all of these science summaries, and they came out just about a month ago, probably less than a month ago. So We started this project back in 2020, and then we have just refreshed all of them. So when you go to the website, you will be able to see all of that updated information. And the structure that I just described was definitely informed by your feedback on the uh, original summaries. And we've also included things on this one like significant references. So you can immediately see all of the references that are associated with the different studies in the science summary. So if we go to the next slide, this is my other favorite part about these curriculum modules is they really help you answer the not only the why, which is what we just went over, but the how. So when you go through both the risk reduction curriculum module, but really all of them, you are going to see how public health action can have an impact on brain health. I've highlighted just a couple of the things here that will come up. You know, you'll learn more about 10 healthy habits for your brain and see lots of resources available to help promote that. You'll learn more about brain health messages and what different health departments have done to message about brain health. I'll also tease that we have a new toolkit, again, coming very soon this fall, that will focus on brain health messaging. You'll see a lot of what people are doing with hypertension control. This always comes up as one of the favorite things to integrate brain health into because it's such a strong correlation with risk for cognitive impairment and dementia and hypertension that, you know, it's a great way to increase awareness about that connection when we're doing blood pressure checks within the community. We have a toolkit about how to host a community convening, which is a meeting of community leaders to address brain health. And this is a great way to involve people who maybe didn't know that the work that they're doing could improve brain health. Something that's come up a lot that is always exciting to me are different bicycle events, right? To talk about helmet use and bike safety. And those folks may not know that the work they're doing is also improving brain health in their community. And then lastly, we have a whole suite of resources on our website about social determinants of health, from infographics, videos, and longer science summaries. And for this information, from my perspective, it really helps you as you're going to talk with other professionals within the health department or the state government to know how economic factors affect brain health, transportation, all of these different areas where, again, people may not immediately be thinking that the work that they're doing is impacting the brain health in their community, impacting brain health in their community. So lastly, I am going to leave you with why would you do this? And so Eva asked me to talk specifically about why would health departments take this module? And my number one answer is that it's education for you, for your staff, and for your partners. I know personally, when I was in public health school, we did not learn about dementia or the risk factors of dementia specifically. So this entire curriculum suite is that crash course you maybe never had. But specifically talking about risk reduction, we have found over the last 5 years, as we've talked with lots of health departments, that these are things a lot of people are learning for the first time. So over the last 12 months, we were able to train 64 local health departments in person. And when we were doing those trainings, we, of course, gave them all a post-training survey because that is the public health professionals that we are. But in that post-training survey, we learned that 94% of them increased their knowledge about risk factors for dementia and how they relate to the social determinants of health. And 97% of them learn new ways to integrate risk reduction into existing programs. So I hope that those stats are enough to entice you to go click into the module and see if you can be like the 94% or the 97% of people that learn something new about dementia risk reduction or learn something new that you can do in your community to improve brain health. And with that, Eva, I'll turn it back over to you.
Thank you so much, Shelby. I always love hearing about the work that's going on at the center and just appreciate the movement that's happening in risk reduction and what that means for health departments doing that work. All right. So now we are going to hear from Alexandra Nordyke and Dr. Matthew Lee. And Alexandra, I'll turn it over to you and let you introduce yourself, but talking about public health and the early detection of dementia.
Thank you, Eva, and good afternoon, everyone. As Eva mentioned, I am Alexandra Nordyke. I am the Senior Research Coordinator at the Bold Center on Early Detection of Dementia at NYU Langone Health. And our center is led by Doctors Joshua Chodosh and Sue Borson. And today I'm joined by my colleague, Dr. Matthew Lee, who co-leads our Community Engagement and Dissemination Core. And we can go to the next slide. So as Shelby mentioned, our center's overall mission is to be a resource for driving evidence-based public health strategies to make early detection of dementia a routine practice nationwide. And then the next slide. So before we get into our work, we did want to share with you, why does early detection of dementia matter? So while diagnosing dementia is a clinical activity, dementia can be detected wherever people living with it are. But early detection too often means any detection. So without detection, individuals who experience changes in their day-to-day functioning suffer in silence. Without detection, it places undue stress on patient-care partner relationships, and ultimately it can be isolating for people living with dementia and their care partners. So our center defines early detection as detecting dementia before a medical, behavioral, or caregiving crisis occurs. So by detecting dementia before crisis, this allows individuals and their care partners to plan for the future and be active members in planning the care. So early detection paired with appropriate assessment of needs and proactive care planning can help connect individuals and their care partners to better understand the available supports and resources that can help them live well with dementia. So our work aims to build the understanding of dementia as a manageable chronic condition through effective public health, clinical, and community initiatives. So we do this by synthesizing evidence-based and evidence-informed strategies, which we have co-developed with our national stakeholders. And here are some of the resources that we have developed and that are available on our website. The first of which is our published toolkit for early detection for health systems on the left-hand side of the screen. And this was a toolkit that we developed with the CDC and co-branded with the CDC. And in addition, we've also developed these two worksheets on the right-hand side of the screen. The first of which is our memory concerns worksheet, the worksheet in the red. This is a printable worksheet to help individuals plan to talk with a healthcare professional about their memory concerns. And here we have a little snip of a portion of the printable document to give you a sense of what we have included to help individuals think through the process. And then we also have our post-diagnosis worksheet, the worksheet sort of in the center of the screen with the blue heading. And that resource explains what individuals can expect and what steps to take next. No, you're fine. And so from here, I will hand it off to my colleague, Dr. Matthew Lee.
Sure. Thank you so much, Alexandra. So, as mentioned earlier, I'm Matthew Lee. I'm an assistant professor at the NYU Grossman School of Medicine, and I also help co-lead what we call our SEND core, which stands for Community Engagement and Dissemination, for our Public Health Center of Excellence on Early Detection of Dementia. And the next resource that I'm really excited to talk about from our center, yeah, let's stay here for a sec, is our brand new early detection of dementia implementation and sustainment decision tree. This interactive tool was developed to really help guide our national partners understand how to think about kind of comprehensively creating a program focused on advancing early detection of dementia. As you'll see here in this little snippet, it is interactive. So as you click through various phases, as well as capacity building steps, and then action steps, it'll guide you through 4 phases of exploration, preparation, implementation, and then sustainment of early detection programs. And throughout, you'll see these little yellow light bulbs that you can click on and off that will reveal additional community considerations to try and center. And so this is available on our website at this link below or under the resources tab. And if you go to the next slide, you will see an abbreviated overview of the tool. This just really depicts the 4 phases. So as once again, you have your exploration phase, which really prompts folks to think through whether you have meaningfully selected a comprehensive early detection approach to implement and sustain. Preparation really guides folks through all the key considerations around whether you have the necessary capacity, champions, resources, and other support to successfully implement your comprehensive early detection approach. For implementation, we really break it down into kind of earlier initial implementation. So when you first start to implement your comprehensive early detection approach and what to think about. And then we also cover kind of middle to later implementation once your program is kind of fully in place. Is it doing what you were hoping it would do? And then we have our sustainment considerations as well. So really thinking about potential gaps in what is currently being implemented and whether there are processes in place to monitor ongoing sustainment and continuous quality improvement. And this tool is featured in the early detection learning module that is coming shortly. Next slide. And then related to the health systems toolkit or resource guide that Alexandra had just mentioned, our center also has 2 new resource guides that are also coming shortly. One focused on CBOs or community-based organizations, and then another resource guide focused on departments of health. And the content from the Department of Health resource guide really drove a lot of the content that you'll see in that forthcoming learning module on early detection. Next slide. So now that I've kind of covered those key products coming out of our center and how they helped inform these new modules, I'm just going to cover a little bit about key opportunities to apply these new curriculum modules in learning environments. So next slide. The first is just when you think about courses and coursework. For example, if you know your school offers a core or foundational course that covers key public and population health theories, like the social ecological model, like life course theory, I think this is a great chance to introduce these modules to learners as practical applications of those theories to key issues around aging, cognition, and brain health. For methods courses in particular, I think this is a really great opportunity to leverage these modules and the accompanying instructor guide to really prompt learners to think about kind of key data needs and gaps, as well as additional methodological considerations that are necessary when collecting and analyzing data from older adults, from people living with dementia, as well as from their providers and caregivers. And then if you know you offer an advanced course or certificate program at your school that's specific to aging and to issues around Alzheimer's disease and related dementias, making this module or these modules a key requirement is a great opportunity to really, for example, administer it as a prerequisite just to ensure that everyone within the advanced course or within the certificate has a certain degree of baseline understanding coming into it. We just have a smattering of examples below of schools of public health that do offer those types of certificate programs and advanced courses. Next slide. And then when you think about opportunities to leverage these new modules for public health training and professional development, I think the modules are a great way to encourage learners who you know are interested in completing a practicum or internship experience related to aging to complete the modules and see if that helps them with planning their projects. And especially in kind of the next steps and future directions pieces of those modules, it may even help them identify potential practicum and internship sites as well. And then regarding professional development, I think career centers at schools of public health, um, it would really benefit them to include the link to the public health curriculum and to these modules under your resource tabs, just to encourage folks who you know might be pursuing careers in aging or cognition or brain health to complete the modules as a great way to show their kind of demonstrated commitment to these key issues. And it would serve as a great talking point for them to mention in their applications and during job interviews. And then in practice settings and policy settings, I think at health departments, service organizations, and other agencies, for new staff, and this is related to what Shelby had said earlier, for new staff who maybe haven't had that sort of concrete education and training in aging or dementia, I think the modules can really serve as a great training and onboarding tool. Next slide. So thank you so much. That's it from our Center on Early Detection of Dementia. Definitely get in touch with us at our email address for your technical assistance needs, and definitely sign up for our quarterly newsletter if you want to make sure you don't miss the launch of our new resource guides, which are coming soon. I'll now turn it back over to Eva.
Thank you, Dr. Lee, and thank you, Alexandra, for sharing about the resources and the brand new resources. It's been such a wonderful partnership to get to hear some of that expertise and really build it into the module as you shared. And just thinking about what does this look like in different capacities? You know, I obviously was thinking courses, but Dr. Lee, you had such amazing ideas for other ways that students and university settings could use this. So thank you for sharing that. All right. So I am going to go ahead and give a sneak peek of the risk reduction module. It is live on our website. The early detection module has similar components, obviously different information, different resources, but some of kind of the same similar foundational components. I'm going to walk through that and walk through what it looks like on our website and how you can access it as well. And again, if you have questions for any of our speakers, please go ahead and put that in the Q&A and they can go ahead and respond to that. And then again, I think we will have some time at the end. We might be able to do some Q&A then as well. Okay, so when you actually get into the dementia risk reduction module, this is what the landing page looks like. And so you would log in, you would go ahead and hit that start button. And then if you needed to take a break or something, you could always leave and then come back to it. It saves your progress. And as what this module is learners, you know, are able to read certain sections and then they complete learning activities as well as they scroll through the module on different topics. So, oh, and I will say these modules both take about 60 minutes, 1 hour to complete, which is why is it great. Saves your progress. So you can start it, go get your glass of water and come back. So the learning modules, we always like to start off with something that really showcases the impact for why this work is important. So our risk reduction module starts off with this video from Elizabeth Head, who works at the Georgia Department of Health, talking about dementia risk reduction and the public health work across the life course. So we like to include videos throughout our modules, again, to just engage learners in a variety of ways. Our early detection module does feature some videos of people who are from our early stage advisory group. So these are people who have been diagnosed with dementia or mild cognitive impairment and are serving as advisory members or former advisory members to the Alzheimer's Association. And so they share some of their stories. So that will be a part of our early detection module is those videos. We also include interactive activities throughout. So in our risk reduction module here, we have a drag and drop activity where people get to sort modifiable and non-modifiable risk factors, and they got to get them in the right buckets before they're allowed to move on. So a fun way just to think about the knowledge, the information you've learned, and then apply it. Here, Shelby talked about this quite a bit about the social determinants of health. And so we use, again, a lot of that center's information and resources and integrate it into this learning module system. So talking about some of those 10 factors she mentioned and some of the science behind them. And so this is a way you get to kind of get a glimpse of some of that information, learn about that risk factor, and then scroll through to the next one. We also include knowledge checks throughout. So again, this is a way to take information that you've been learning, pause for a moment, apply it, think about it, and then move on. This isn't a part of a score at the end of the module. This is just a way for you to, or a learner to take a moment to think about the information and apply it. So for example, this is a multiple choice question. You click your answer, you click submit, and then it would pop up and it would give you some feedback on if that was the correct answer or if it was not. And then you'd be able to move on. Here we have, again, some more information about the social determinants of health, and then as well as public health interventions that can work to address those social determinants of health. So here, for example, if you're clicking on one of these flashing icons to learn more, oh, this one here is about educational quality. So you could learn about how quality education impacts brain health and risk reduction. And then you could learn more about an intervention that's useful for addressing that social determinant of health. And you would click through all of these and then you could move on. Here we have a drag and drop exercise. So this is thinking again about what maybe that social determinant of health would look like, and thinking about brain health, and again, just kind of applying some of that information for a learner. So reading through, you think, oh, I think I know which one's nutrition and food security. You could move that to the correct spot, and oh, that's correct. It stays in the box. If it's not correct, it bounces out and you get to try again. And then as Shelby shared, and as Dr. Lee mentioned, we include a lot of information about the topic, as well as a lot of information about what public health departments are doing in this area. So here in the risk reduction one, we start off by talking about data and how health departments are using data. One example of that is heat maps. And so this is something that the Public Health Center of Excellence on risk reduction, does provide. So we provide an example of that here. And so this would be, something that a student could look at, think about, oh, interesting. And then actually, if you wanted to request a heat map, you could do so for your county. But this would be a way to look at, oh, what does diabetes map like in my county? Or what is hypertension? And then how do those two things, which are risk factors, overlap? And what does that mean for public health action? So trying to, again, include examples of work that's being done by public health departments in this space. And we do that throughout all of our modules. And here, for example, we do a fairly in-depth look at what Greendale, Wisconsin is doing. So real place, real work, real stories. This is a great example. They have done some work with a bike program. They've done some work with a gardening program. So you get to kind of click through and learn about their work that they're doing. And then, as Dr. Lee mentioned, there's a next steps section at the end. And so this is a place where students or professionals who are looking for things they can do next to continue learning more, they could, here it's showing downloading toolkits, staying informed, whole variety of options as you scroll through this section of next steps that somebody could do if they wanted to continue learning on this topic. And then there's finally our resources page. So again, these are just kind of the links that we think might be useful for a learner as they're going through the module. So that is just a sneak peek of what the dementia risk reduction module looks like. I hope that you get online and check it out. You can find it through our website, alz.org/public health curriculum. So I encourage you to log in and check that out. And as we've said, the early detection one's coming very soon. So definitely encourage you to check that one out as well when it comes. So when you do get on our website, I do want to walk you through a couple of other resources that are available as well. So the first resource that is available is this flyer. And this is a one-page flyer that's specific to this topic and this module. So if you do know somebody, have a professor or a colleague who's interested in this topic, this is an easy resource. That's a one-page resource you can share with them. I will also mention, if you are reading the description on this page, you will notice it mentions about earning one free CHES credit. So if you are a certified health education specialist looking for CE continuing education credits, all of our modules are accredited through APHA for CHES CEs, and those are all provided free. So always a great resource as well. Another resource that's on our website is the instructor guide, which Dr. Lee also mentioned. And this is a resource, again, it was designed with faculty in mind, but if there's other settings that learners are using this information in, These instructor guides include discussion questions, they include learning activities, they have sample test questions. So all sorts of resources that are really just packaged together, hopefully making implementing this resource easier in whatever learning environment you are in. So again, if you're wanting to host group discussions, this has some discussion questions. If you're wanting to have an application activity after somebody has completed this module in their course, we suggest some of those. So encourage you to check that resource out as well. It's on our website. And then what will be soon, after this webinar is over, like I mentioned, it will be recorded and it will also live on our website. So you can always come back and watch it again. And then the other thing that's available on our website, it's actually up near the top of the page, is the step-by-step instructions for accessing and completing the curriculum modules. And this is because the modules do live on our learning management system. And so there are a few steps to creating the account and logging in. And so we just put all of that together on a simple one-pager so that you can share that with whoever is learning or using these modules. They don't have to watch the whole webinar. You can hand them the one-pager and that will be a great resource to help them walk through how to access and use the modules. So we'll do that together now, but if you click on the link, start the module that goes with the respective module on the web page, it takes you to our learning management system. So this is what our learning management system looks like, and it will take you again to the specific module that's tied to the one on our web page. If you go to training.alz.org/public health, you can access any of the modules. That's another way to do it. Or if you go to our learning management system, training.alz.org, and click on this public health tab, another great way to access it. I think it's easier to go through our website because that's got all the resources, but just wanted to provide a couple options. So if you do go to our learning management system here, it will show up and ask you to log in. So you do have to log in. And then when you click on it, it takes you to this page here, and you can either enter your existing username if you've taken modules with us previously or done anything else on the Alzheimer's Association's learning management system. There's lots and lots of great resources. If this is your first time, you do have to create an account. It's free, simple to do. And once you've done that, it takes you back to this page where now you get to enroll in the course. And when you hit enroll now, it takes you to this page where you can now launch the course. There is circled in orange. And so when you do launch the course there, it takes you to that landing page I showed earlier of the people walking, and then you get to go through the module. After you have completed the course, this survey here unlocks, and now you can complete the survey. And this is a user experience survey, so it's not a pass-fail sort of thing. It's a feedback for us as public health professionals, as we are, as Shelby mentioned. But we do really encourage folks to complete that survey because it gives us good information on knowledge learned and how this could be used. Also, once that survey is completed, the certificate of completion is unlocked. And that is a great way if you are wanting to document whether students or other learners have completed this module. You can ask for the completion certificate, as that only unlocks after they've completed the whole module and the survey. This is, a great tool to have if you want to show that you've done this learning. When you do click on print there, it shows up as a PDF with the name of the course, your name, and the date of completion. And then, as I mentioned, if you are looking for Certified Health Education Specialist credits, you do click on this link here, and that takes you to APHA's website where you can go through their process and their survey to be able to claim those credits. They are free. And that's optional if you're not looking for those credits. All right, so this is why we have it all in a nice little one-pager as well. So I'll just mention that again. It's on our website. Encourage you to use that if you're looking to get into the learning management system and didn't write down all those steps. And as we mentioned, coming soon, the Public Health and Early Detection of Dementia module. So definitely encourage you to sign up for our newsletter if you haven't already. This is where we announce the launch of all of our products, the release of our new materials. So this is where we will be announcing the release of this new module. So definitely encourage you to sign up for that. We do occasionally have funding opportunities as well, so other great resources as they come out. And I think that's all that I had for today. So we do have a little bit of time for questions, but first I just want to say thank you to all of our speakers and presenters and everybody who worked so hard to make this module, both of these modules come to life. They're, I think, going to be amazing resources to really add to the toolbox of what public health professionals can do in dementia space. So feel free to email us if you have any questions, but I will go ahead and stop sharing my screen and have our presenters join us to see if we have any questions that we would like to answer.
Yeah, Eva, we had a lot of great questions come in, many of which are not the expertise of the four of us on this call. So had two things to say. One, some of the questions were related to our Caregiving Center of Excellence. So when Eva sends the follow-up email, which will have access to the recording to this webinar, she's also going to share the contact information for all three centers of excellence. So you have that in one place and a way to ask those questions. And then additionally, for some of the other questions on there, I put our publichealth@alz.org email. While we won't be able to answer some of those questions on the call today, there are answers to many of those questions and invite you to follow up with us via email so we can connect you with the other members of our team who can provide a better answer to those questions. Otherwise, there were a couple of questions about the Lancet Commission report, which I wanted to briefly address, and then I think others we were able to answer in the Q&A box. So just related to the Lancet Commission, this is a report on the modifiable risk factors for dementia. It's one of a lot of different journal articles and review articles that have been published. And some of the questions were pointing out that our conclusions are a bit different than theirs. That is accurate in that we concluded the stronger level of evidence differently than the Lancet Commission did on some of the risk factors. But if you look at all the risk factors that we include in the center and in the science summaries, you'll see the ones in the Lancet Commission there. It's just that we've made different conclusions on the level of strength of the evidence. And that's just based on, the different experts that did that analysis and the papers that we looked at to make those decisions. But all in all, there's large agreement on the things to do to improve your brain health. And I think that you'll see that as you read through the different science summaries and take the risk reduction curriculum. There's a ton of alignment. But yeah, Eva, I think that is it from the Q&A box. If you had any other questions that had come to you.
I don't think I had any come in, but I would just be curious if we would end on, I'm excited about these modules, and I'd be curious to kind of hear from our speakers. What are you excited about in the areas of public health, risk reduction, early detection as we move in to the end of this calendar year and the start of the next one? So Shelby, do you want to go first?
Sure. So there's been a ton of excitement and new evidence in the area of risk reduction. And that's part of why we updated the science summaries this year. It was really neat to see all of the studies going on and all of the new information coming in. I am also personally excited about the interest in or from health departments to share this information with communities. We'll be launching new public health state web pages later this week. And there are so many stories to share about the great work going on across the country to spread or increase awareness about the risk factors for dementia. And so that's been great to see. And that's all possible because of this increased public health infrastructure that we've been building together over the last 5 years.
Thank you. Dr. Lee or Alexandra, do you want to talk about what you're excited about?
Sure, I'll go next. I think a lot of the partners we've been working with have been really interested in having more complete and more comprehensive data to drive their efforts. And so that's really been a key area that I've been excited to see action and energy around. And as I mentioned, with our forthcoming resource guide for health departments, we have a whole section on addressing data needs and kind of creative ways to think about meeting those needs. So I'm really excited for what comes next with that particular area of work.
And I'll just echo Dr. Lee, but also add, I'm very excited about the opportunity for our partners to sort of figure out how to and strengthen their cross-sector relationships. At our center, we are very three-sector focused, health systems, departments of health, and community-based organizations. So I'm excited for practitioners in the field to use this upcoming module and our upcoming resource guides to figure out how to navigate all these linkages to support early detection of dementia.
Yeah, thank you. And I did see a question come in about community health workers. Shelby, do you want to touch on that?
And Eva, I think maybe you could even say a little bit more about this for those who aren't familiar with the CHES certification of who has that and how this might be useful. And even though the modules have been around for 10 years, this is something very new. And so even if you've taken it before, you can go take it again if you need that CHES certification.
Yeah, the CHES certification, so that's Certified Health Education Specialist. That's people who've completed a certain set of competencies and taken an exam to prove that they're certified as health educators. So I've been through that process. I work to maintain my community or my continuing education credits, but they work in all sorts of different settings in the community, in academia, just kind of, yeah, so it could be useful for anybody who's trying to, again, maintain that certification. And it's, again, a free resource. And I think what I have tried to do from my perspective as a CHES who, again, takes those CEs, is to think about how could this be useful? How could this curriculum module be useful for somebody who's working in public health that is not specifically brain health or dementia? So they are category 1. I just saw that question come in. And so yeah, so if you are working in hypertension, if you're working in smoking, if you're working in maternal child health, thinking about how could I integrate brain health work into that work that I'm already doing. So yeah. All right. Well, I want to thank the panelists again for coming together today to share their information, their insight, their ideas, and for answering all those questions. I was just glancing through them. Lots of great questions, lots of great engagement from all of our participants today. So thank you for being here. Thank you for learning and sharing these resources. And again, please feel free to reach out to any of us at the centers with any questions, or at the HBI with any questions that you might have. And we, again, will be sending out a follow-up email as well. So thank you for being here, and hope you have a wonderful rest of your day.